You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with macular degeneration. With us, we have an expert on the topic, internationally known, Dr. Ron Gallemore. Dr. Gallemore, welcome to the program.
Hey, thanks for having me, Randy.
Now, before we get into today's topic, because you do more than just macular degeneration, tell us about your center. What kind of patients do you see?
Randy, we actually have patients from all walks of life. It's pretty amazing that even children get affected by macular disease.
Is that right?
Yeah, it's amazing that we actually have the opportunity to help patients keep their vision or restore the vision in children, patients our age, and elderly patients. And so,
now, I've been told you are one of the top retina surgeons in the world, or specialists in the world.
Well, I've been told that too. And,
is that right? Okay.
It's
you publish a lot of papers?
I've published over 100 articles and book chapters, and I give probably about 40 or 50 lectures a year around the world. And it's also another way to stay on top of the cutting edge, see what's going on around other parts of the world, and also help other people in other countries stay at the cutting edge as well.
How does somebody get to see a specialist like you? Do they, just ask?
Well, you know, to see a specialist, it's best to go through your general eye doctor because they can identify the problem that you have.
But they can request you.
And they can request us, and they can request our institute or myself, because you want to go to the right person for your problem. And so most of our referrals come directly from other eye doctors, and they know that there's a retina or macula problem, and then we can take care of it.
Good. What about clinical research? Are you involved in that as well?
Clinical research is a big focus of our institute. I have a PhD in neuroscience, and along the way I did a lot of basic research. Part of my publications are related to the neuroscience and how it affects the retina or the macula and the eye in general. And it's been exciting to watch the laboratory research work its way into the clinic, and now we can provide care for patients in part because of the research we did in the laboratory. So I'm involved in over 12 basic and advanced clinical trials providing the most advanced care for patients. If you have a patient, for example, that has failed conventional treatment and they've been told there's nothing more that can be done, there's some new treatments that are available to them that may give them a chance.
So you're doing things there they're not doing anywhere? Obviously.
Yeah, there are some studies we're doing that are unique to our center and provide unique ways at looking at macular diseases and unique treatments.
Okay, now we invited you on the show to talk about new treatment options for macular degeneration. How big of a problem is it? How many people have it? And what is it?
Macular degeneration really comes in two major flavors. There's the dry and the wet. And all patients with macular degeneration start out dry.
Well, how many are there, by the way?
There are actually about 20 million to 30 million. It's an epidemic. It's a silent epidemic. There are more people that have this disease than you would realize. In fact, when you're in a room with 20 or 30 people, sometimes half of those people will be at risk or have already developed macular degeneration. And the exciting thing is that these are patients we can do something about. By knowing their background, either heredity or exposure to UV light or their diet.
So it causes blindness, by the way. Is that right?
It's actually the leading cause of blindness in the entire country and in all developed nations throughout the world.
So half the people get it?
It's up to half the people can be affected by the disease later in life. You'll find these little deposits in the back of the eye called drusen. And in my patients over the age of 60, more than half of them have these spots in the back of the eye, and that places them at risk for blindness.
What are the symptoms?
The symptoms of macular degeneration range from nothing, you're walking around, you say, you know what, I'm doing great, I have no problems, and you have the disease, to not being able to read, drive, see your loved ones because of distortion or a black spot in the center of your vision.
In the center, just in the center?
Right smack in the center. Rarely do patients lose all their vision. Patients lose their central vision. So anytime a patient finds themselves having trouble reading, driving, seeing their loved ones, watching TV, it's important not to ignore these early symptoms.
So it's blurred in the middle or
spotty? It can be blurred and spotty and distorted. So anything that involves the center of the vision can have an association with macular degeneration.
The people self-diagnose, they're in their 60s, and they say, you know, I think I just have a cataract.
You know what, that's a big problem. Yes, patients come in, and once in a while doctors, you know, general eye doctors aren't able to pick up some of these early macular changes, and they might attribute it to a cataract, or you can't detect it without some sophisticated testing. And in LA and Southern California, as a rule, the doctors are very sophisticated, and they know that if a patient has a reduction in vision, before they jump in and fix that cataract or glaucoma, they need to make sure that the retina or the macula isn't the problem. So we do testing that allows us to determine if the problem is really the front of the eye, the cataract, or at the back of the eye, for example, the retina or the macula. And if we jump in early when we make the diagnosis, we can either not only save their vision, but sometimes reverse the vision loss, restore their vision, and prevent further vision loss down the road.
So if you catch it early enough, you could always reverse it, or most of the time reverse it? But
Actually,
always stop it?
We can pretty much always stop it. The clinical trials have shown that in 95% of cases of patients with wet macular degeneration, you catch it early, you can stop it. And half the time you can improve the vision or restore the vision. So catching it early is really the key, and that's why we work so closely with the general eye doctors in the community to make sure their patients are aware and sensitized to these vision changes that occur early, the vision changes you pointed out.
So of these people you say that self-diagnose, or I said that they self-diagnose, and they think they just have a cataract.
Right.
What do they do? I mean, do they get in and see an eye doctor?
Yeah, they need to see an eye doctor right away, Randy, because if they catch these early symptoms and they report them right away, they'll get the care they need right away.
Insurance covers this, right?
Insurance covers
I mean, what you do, it also covers it,
They
right?
cover it. It's considered emergency or urgent care. So it's a risk for insurance companies not to allow their patients to get the care that they need urgently, because if they wait too long, they're going to lose their vision. They're not going to get it back. So it's an exciting...
Do you see people, by the way, that are almost blind, that if you would have just saw them years ago, a couple years ago?
All the time.
You could have saved them, really?
All the time, yeah. We have patients
that are near
every day.
blind.
They come in and they cannot see, and sometimes it's too late. They're way advanced. Many times we can help them, even though they are quite advanced. But if we catch it early, it can make a difference.
What is their excuse for not doing anything about it?
Well, a lot of times they say, you know what? I thought I was just getting a cataract, like you said. I thought it was just getting a little blurrier. I didn't want my cataract surgery. And then I realized I couldn't read or drive. And by the time they got in, it was too late to get all their vision back.
Is it very slow to happen?
It can be very slow, and it can also be explosive. Some patients lose their vision overnight. You can have a hemorrhage, or you can have a tractional event, which means pulling on the retina that can lead to loss of the central vision. If you catch it early and report it early, we can almost always save the vision or even restore the vision.
Okay, you mentioned wet and dry. What's the difference?
So dry macular degeneration is the process of damage that occurs over many years. It's usually from oxidation. You've heard about aging, oxidation.
Yeah.
Your other experts have talked about oxidation and aging. It applies to the eye as well, and you get these deposits and atrophy.
And they're behind the eye.
And they're back of the eye, Randy, where the retina is. So the eye is like a camera, and the light focuses through the front of the eye, through the lens, onto this film at the back of the eye, which is the retina. The very center of the retina is called the macula. And that area is where all the energy of light is focused, and that's where the damage occurs. That's where the oxidation occurs. So you get little deposits and thinning and oxidative damage that lead to a slow degradation of vision. Then the wet form comes, and that is the body's attempt to
So the wet is a more advanced or different?
The wet is a more advanced form.
Okay.
It is always more advanced, and it's different at the same time because it's a different process, a different cascade of mechanisms that lead to the wet macular degeneration. So the treatment of dry and wet are different.
Does the eye leak?
The eye leaks. Blood vessels
tearing?
grow. Well, it leaks on the back of the eye, inside the eye. So you don't get tearing. You don't notice that you're having this problem other than the blurring of the central vision, the loss of reading, the loss of driving, the loss of watching TV comfortably. And the leakage in the back of the eye can be stopped by using factors that we put in the eye to block the leakage, to dry the retina, and actually restore the vision.
So let's start with the treatment options. And also, what has changed in the last 10 years with treatment?
Randy, it's amazing. In the last 10 years, it's been a whole evolution in treatment. 10 years ago, when a patient got macular degeneration, we'd look at him and say, Mrs. Jones, I'm really sorry it happened to your right eye. Let's just pray it doesn't happen to your left.
Really?
Now,
so they were going blind in the old days?
Oh, yeah.
10 years ago?
Oh, yeah. Just 10
Is that
years
right?
ago. Even
I
2
didn't know
years
that.
ago. There are patients we couldn't even treat just a couple years ago. Over the last 10 years, dry macular degeneration has been shown to respond to nutrition.